Hi. Before I proceed with my lesson on this wonderful topic, drugs and drug abuse, please, every one of you stand up. Give yourself a sound clap. Another one. Another bigger one. And the last one. If you've just done that, I'm glad, I'm proud of you. Happy meeting you. Don't forget, our primary focus today is on the topic drugs and drug abuse. We want to teach you basically on how to avoid drug abuse, what drugs are, and also to identify who a drug addict is and try as much as possible to avoid drugs. I love you and I would love to see every one of you pay close attention. Don't forget, at the end of this lesson you will have a gift for yourself. Thank you. Wow. Ambe Amos Lupe is my name. I am a Nigerian, an indigenous of Benue State, a proud volunteer of Kakuma Academy. I am glad meeting you here and I love you all. Hope you love me. If you love me, just give me thumbs up. Don't forget, I am your teacher and I would love to give you the best. The only thing you can do for me is sit quiet, pay close attention, enjoy the lesson, and at the end of the day you answer those questions and pick up a gift. I'm sending a gift for you if you are able to answer the questions perfectly. Thank you. Hi everyone. I can see the smile on your faces, ready and willing to learn. I'm glad you're here. At the end of this lesson, I want every pretty face here, every beautiful and some young man here or child sitting before me to be able to, one, explain the meaning of drugs, and then two, you should understand when drugs are abused, and then the third one, you should identify a drug addicted person, and then the fourth one, mention 5 negative effects of drugs abuse, and then the last but not the least, number 5, say you should state 3 measures of preventing drug abuse. I will be glad if you are able to give me this. I'll give you thumbs up and don't forget there'll be a gift for you. Thank you. Wow. Here we are just looking at our introduction. And what I wanted you to do here is just for you to understand drugs abuse and addiction. But you can't just do that. I want you to think. What do you think will happen to you if you take drugs more than the required dosage prescribed by your doctor? Tell me, when the doctor says you take 2 tablets, only 2 tablets, and then you take 5, what do you think will happen? If you said you should take 1.5 and you take more than that, what do you think will happen? Don't forget, you are just abusing drugs and there will be a repercussion, there will be a result. Please tell me what you think will happen. The other side of it is, who is a drug addict? When they say someone is addicted to something, what do you think they are saying? And if you see an addict, someone who is addicted to drugs, how are you going to help him or her out of that situation? Please don't leave anyone who you notice that is addicted to drugs. But what you do for me is tell me what you're going to do for that person as you prepare your mind to move to the next slide, because it might be discussing what I just asked you here or not. But please prepare your mind on what you will do when you see an addict or you happen to stumble into one who is addicted to drugs. I love you. You give me a wonderful answer, I have something for you. Thank you. Hey, can you see what is happening here? This lady is an abuser of drugs. Drugs are meant to be given, especially injections like these, by the doctor. But just watch what she's doing. She just pick that syringe and is trying to inject herself without the help of a doctor. Doctors are professionals. They know the amount of drugs they are supposed to take. But see her, that's even you can see in her eyes, she is already affected because of drug abuse. She has been abusing drugs and her health is in very serious danger. It is reading all over her body and she is head on doing it. On the other side, you see this family, they are addicted family, they are drug addicted family. Even with their child seated beside them, they are training her on what is not right. Taking drugs. Remember, drugs are substances. They are food substances that enters your body, but most of the time, most of them are not good for your health because they carry chemicals that can destroy your body. Now look at them. Even in the sitting room, they are addicted to drugs. They can't control themselves and they are taking drugs without prescription of the doctor. In fact, some, as you can see, they are already on alcohol, which is not healthy for the family. And I will advise you, if your parents are involved in any of these, please help stop that. Don't allow them abuse drugs or get addicted to drugs. If you see anyone around you who is addicted to drugs, please stop them. Thank you. I will love it if you do that. Don't allow your family members to be addicted to drugs. Once again, thank you. As we move to the next slide. Drugs, drug abuse, and drug addiction. What are drugs? Drugs are chemical or food substances which have functional effect when introduced into the body. Don't forget, I say they have functional effect when introduced into the body. They are chemical or food substances which have what? Functional effect when introduced into the body. What is drugs abuse? Drug abuse is simply the misuse or overuse of substances called drugs. I repeat, drugs abuse is simply the misuse or overuse of chemical or food substances called drugs. Drug abuse is simply the misuse or overuse of chemical substances called drugs. Drug addict is a person who cannot function without the use of chemical substances. Who is a drug addict? I repeat, he or she is a person who cannot function without the use of chemical substances. I repeat, drug addict is a person who cannot function without the use of food or chemical substances in his body. Okay, on this slide we'll be looking at what the negative effects of drug abuse or drugs abuse. Now, when drugs are abused, there are certain effects that your body will experience, and those effects are not nice at all. They have a damaging or life-ending effect on your body or your life. Now, We are telling you this now to make sure you help correct that. If you are abusing drug or you have ever tried doing that, you shouldn't do it. Or if you've seen one abusing drugs, try stopping them from doing it to help save a life. And this knowledge is not just for you to keep it, but to share it with your friend, your mate, your colleague, whosoever you have around you. Take note of this. Now, your immune system can completely be damaged if you abuse drugs. Now, these negative effects include: number one, a weakened immune system, increasing the risk of illness and infection. Now, when your immune system is weakened, what happens? You are at risk of any illness at all. That is why HIV can switch in easily. Headache can destroy you. Even ordinary malaria fever will destroy your body system or destroy your life because your immune system is no longer strong. Those anti-agents that go against sickness, they are no longer strong, they are weakened, and your body is prone to any illness at all. The second one is heart conditions and lung disease. You experience heart failure and so many other diseases that goes with the lungs. And then we have the third one, nausea and abdominal pain. Now this can also lead to what? Changes in appetite. You don't have good taste for your food, and you also lost your weight. You don't feel strong, you don't feel balanced again. And then the fourth one is increased strain on the liver, which put the person at risk of what? Significant liver damage or liver failure. These are dangerous diseases that can kill instantly. And then lastly but not the least, we have a lot, but on this slide this is how much we can take. The last but not the least is seizures, stroke, mental confusion, and brain damage. It damages your brain that you don't assimilate things easily, you don't understand, you don't keep tracks of what you were taught. So you are expected to avoid these negative effects of drug abuse. Thank you. Pay close attention as we move to the next slide. This is one of our slide that is also important, and I want every one of you to take or pay close attention to this slide because it will help you avoid drug abuse or prevent it at all times. Now, there's room for cure of any diseases. There's also room for prevention, and that is why we are trying to open your eyes on how you can prevent this attitude of abusing drugs or becoming addicted to drugs. Now, one of these is the use of drugs prescribed by the doctor. You use strictly drugs that are prescribed by the doctor. The ones the doctor asks you to take, you take them. The ones they say no, they are not good for your health, don't try it. Now, if the doctor says you should take 2 tablets, don't take 1. Don't underdose it or don't overdose it. Make sure you take the required prescription by your doctor. And that is why doctors' attentions are drawn to every form of sickness. Now, once the doctor said this, make sure you go by it because they are professionals and they don't want your life to be at risk such that you may end up losing it. That is why you need their services. Always check your doctor and take their instruction when it comes to drugs. Then Another aspect, which is number 2, is legal punishment of abusers and addicts. There are people that go on taking Indian hemp, marijuana, and all those other ones. The law should switch in by punishing those offenders, send them to prison, jail, so that they can learn of their mistakes there, and by the time they are out, they will be normal and good citizens of such nations. And then the third one is parental control of children drugs. Children, you are not supposed to take drugs outside of your parents' understanding. Always seek their consent because they know the dosage for you as prescribed by the doctor. So don't, and I repeat, don't take drugs without your parents' understanding. Don't see drugs on the floor, pick them, and then you use them. They might kill you. So be careful with any drug you take. And then the third one, the last one, the third one, number 4, is law enforcement agencies should monitor the use of hard drugs. The police, the NDLEA, as it may be in your country, those ones in charge of drugs, please, they should monitor the movement of hard drugs like Indian hemp, marijuana, and all those ones you know. Thank you so much for paying close attention, and I believe you've learned a lot so far. Finally, we are on our second to the last slide, and I want you to reflect back to what did you learn. Will you be able to answer these questions? If I ask you, what are drugs? Will you be able to tell me? And if yes, tell me, what are drugs? Secondly, when are drugs said to be abused? I want an answer because I told you there's a gift for you. The third one, who is a drug addict? What are the negative effects of drug abusers? What solutions or how can we control or prevent the abuse of drugs? And then finally, how can you help one when you see or discover he is addicted to drugs? Now we go with this. Don't forget, and as I tell you this now, just to recap or round up my lesson. Remember, we say drug abuse is when you use illegal or legal substances in ways you shouldn't. That is, in ways you should not. You might take more than a regular dose or pills or use someone else's prescription. You may abuse drugs to feel good, eat stress, or avoid reality. But usually, you are able to change your unhealthy habit or stop using altogether. So, always use drugs according to the doctor's instruction, that is prescription, to enable you live a healthy life. If you are happy that you enjoyed this lesson, please put your hands together for Mr. Amber Amos Looper. I love you, and I will send your gifts to you. Thank you, and have a wonderful day. This lesson was prepared by Amber Amos Lupe, your wonderful teacher who loves you. The template by Jim Pedrick and graphics by Nine Vienne for the Kakuma Academy Project Kakuma, January 2020. The attributes license is what you see down. Thank you for the opportunity to have this wonderful class with these children.